So today's topic is the totality in homeopathy. The question is, what do we mean by that word? So we're going to turn to Kent as usual, and we're going to be looking at the symptoms and aspects of such cases as present an unfavorable view and cause an unfavorable prognosis. Here, the point here is that Kent starts by stating that to one who knows the totality as written out, it may mean a clear symptom image and a sure index to a remedy the patient needs, which generally goes with a prediction of speedy recovery. So, in this article in the beginning, Kent basically lays the foundation of his prescribing method, which is actually the method. It's not a method, it's classical homeopathy, which is a focus on the totality. And by totality, we mean all the characteristics of a human being on the mental, emotional, physical level. That's the total symptoms, right? The totality of symptoms. And we also, there's an added meaning that we, of course, identify a pattern of symptoms based on looking at the totality of a patient. So you can't just prescribe on a local symptom like joint pain. You have to look at what the patient wants to eat or drink, how he sleeps, etc. Kent says, to one who lacks training and experience, the totality as written out is a complex symptoms. That means chaos. So you will not be able to find the right pattern if you don't practice finding or looking for the totality in a patient. As one gains knowledge by training, reading, and experience, the symptom complex is less common until he is capable almost at a glance of some cases ever so carefully taken that the whole case has the stamp of complexity. Yet some of these after much study will reveal the image in the totality, and it can be seen that what is the remedy, but it must be known of any case that so long as it is chaos, just so long as a favorable prognosis is to be withheld. So, in homeopathy, unless you find the totality, you will not have a favorable prognosis. That's basically the point here. And of course, a lot of people in homeopathy neglect this aspect of this science, and also not just in homeopathy, but all the other alternative healing methodologies. People just forget to look at the holistic aspect. So they just practice natural medicine as from the perspective of modern Western materialistic medicine, not holistically, right? There's more to be learned about the diagnosis and prognosis by studying the complex of symptoms than by any form of physical examination. Right. So we're not interested so much in the physical symptoms, local physical symptoms, unless they're keynotes, of course. Kent says experienced homeopathic observers know very well that the burning, stinging, enlarged glands, infiltration, hardness of the part, weakness, loss of flesh in a scurus of a mamma will not lead to a remedy that will act curatively. Also, that edema of extremities, weakness, albumin in the in urine, and heart symptoms, dyspnea, and anxiety furnish no basis for a remedy for the patient. So we don't care about the symptoms of the actual health condition that the patient is suffering from. We're looking for the totality, and within the totality, we're looking for patterns. We're looking for unique, peculiar symptoms. All know that remedies given on such symptoms are only expected to comfort and will not restrain the progress of disease nor very much prolong life. Well, I don't think all know this because nobody cares about this anymore in homeopathy, except for the classical homeopaths. Um, but yeah, if you give a remedy on local disease symptoms, it's only going to be palliative and will not uh, trigger a healing reaction, a real one. That's why a lot of patients go to homeopaths and feel a little better, and they just start spreading the word that the homeopath they went to is so competent that it's amazing. But actually, the homeopath is not doing anything but palliating, right? Um, what else? Um, Kent adds something here, which is the advice that we must look for the totality, even in difficult cases. There's no other way of doing homeopathy. And he gives the example of the hysterical patient who presents an incongruous symptom complex that always deceives the neophyte. So the hysterical patient is just an example for a difficult patient. And of course, neophytes will gather all those symptoms, imaginations, and sensations, which are usually delusional. Most of them, these are going to be delusional. And this is not what we have to look for in a hysterical patient. Kent says we have to look for uh, such a case remains incurable until the symptoms that stand for the patient are known. These generally are found if they are discovered to be changes of desires and aversions, loves and hates. That means that's the totality or the big picture. You always have to be looking at the big picture, right? What is the general characteristics of the patient? So Kent says even very difficult patients have to be treated this way. Of course, hysterical patients. If you're not a therapist, you might not know, but a lot of people are hysterical patients are unable to recount their symptoms objectively or truthfully or factually because that's how they are. There's a confusion, a kind of hypochondria, a kind of confusion, and a lot of people can't talk coherently about their symptoms. So Kent gives some advice about this. These are the most difficult to secure, as every hysterical patient conceals her real loves and hates and relates such as are not true of her. Hence, it requires the skill and power of an experienced, strong mind, which cannot be deceived to question her whether when she has lost regard. So you might try this with a hysterical patient. You can question her firmly when she has lost her guard, and you will need a very strong mind which cannot be deceived. Uh, Many people will try to deceive you in life. Most people in life are deceivers, and hysterical patients are, of course, the worst type of deceivers. But it can be said that deception has become so normal in society that any patient coming to see you should be automatically considered to be lying or deceiving you. But So the point here is to always look at the totality, even in difficult cases. Thanks for listening. And if you would like to do a homeopathic consultation with me, you can get in touch on Telegram. You can find my Telegram in the channel description.